Well, I am continuously humbled by the work that we're doing, that the people with whom we're working allow us to into their world and allow us to build relationships with them so that, as I said, they can help us to devise solutions to some of the problems related to health disparities in their area. I am continuously reminded about how blessed I am to be in the position that I'm in because of this, because of the interactions that I have with them on a regular basis.
I love my job here at the Health Science Center. It is seriously my dream job. I started out here as a volunteer just because I completely agree with everything that's going on here, the focus on health. I just love that I'm able to provide the community with the tools and the resources to make a difference and partner with the Health Science Center in making a difference in the community.
One of the reasons I'm here is because I like to teach. I mean, I could go off and do the clinical medicine aspects a lot of places, and I have. But one of the things that I'm allowed to do here, encouraged to do here, was hired to do here, is to teach students. And I love teaching students. I enjoy interacting with them. I enjoy seeing lights turn on. I enjoy just being in front of the classroom.
So you see direct results of your work. If you weren't doing your job well, you would hear about it. Almost instantaneously. Our students don't put up with a lot of shoddy service. So, if you're doing a good job, you get immediate results from the people here, immediate response.
I think the sense of community amongst the staff, the faculty and staff, is a great thing. Also, the growth that we're seeing right now, it's ever changing, and it's. I really am looking forward to what the future brings.
From my perspective, we make a difference by really keeping it community-based, keeping it small but yet cutting edge. I was a student here, so I understood or experienced rather the growth, if you will, and I can put in perspective, or I've been attempting to put in perspective what was then and what was now. And one of the things that remained consistent was that you felt a niche of community. You felt that it was giving you what you needed to be cutting edge in science and be a leader in science, but yet you felt connected with everyone around you.
At the UNT Health Science Center, since I've been here for the last 2 years, I feel I received consistent teaching and research support for my work. To give those future medical professionals the new and better ways to help their patients for higher quality of life.
There are awesome people around this campus. It's a very warm campus community. People are very committed to helping one another. We have great students. I've had the opportunity to see many of our students go on and do great things. And it's just a very rewarding experience to know that you had a hand in that in even some small way.
It's got terrific faculty, terrific students, and terrific postdocs. We also are really well set up to do research, so very well-funded labs, well-equipped labs, and very dedicated individuals trying to do that.
Well, I think UNT Health as a whole really is creating or wanting to create an atmosphere in which a patient or individual can develop through mind, body, and soul. We are working to develop healthy bodies, healthy minds, and through that, it does create a healthier soul in that you feel better about yourself. You gain confidence when you feel healthy and physically good. And I think that when each individual in the community can feel good in their mind, body, and soul, it creates a community of better feelings, goodwill.
We are growing. There's so many departments and so many areas of the center that people don't know about, and with that, I feel rewarded to even be part of this era of the center and my life.
UNTHSC makes a difference in a way no other institution at which I have taught or worked does or did. And what I mean by that is we are coming together, we are expanding the reach of this institution at a time when we have the critical mass of faculty and students to make that a very, very enviable and enjoyable enterprise. I've never been in any university system in which faculty seem to be more interested in collaborating with each other. And students are really encouraged and supported in their endeavor to work together as teams of learners. It's a great place to be at this moment in time. And because of that, I think the Health Science Center has a future that opens before it that no one could calculate the reach of. I'm glad to be a part of that. I'm so happy to be here at this moment in time.